Hi everyone, Dr. Daniel Shanahan here again from Lakes Foot and Ankle Associates. Thanks again for checking out our latest YouTube video, and as always, make sure you receive our latest content by subscribing. If you like this type of content, hit that like button, and to receive our notifications, hit that bell icon. If you have a question you want answered, leave a comment below. We will be happy to get back to you and answer that question. This is the third video in a series of videos addressing foot pain. Our first video addressed the topic of general foot fatigue and achiness. The second video addressed pain to the ball of your foot area. You can find both of those on our YouTube channel. This video will address the topic of nerve pain and pathology to the foot. Nerve pain is certainly no fun to experience anywhere in the foot. It can occur with the smallest of nerves right up to the big nerves that reside in the inside of the ankle area. Probably the two most common well-known nerve pathologies of the foot and ankle are something called intermetatarsal neuritis and tarsal tunnel syndrome. The old school term for intermetatarsal neuritis is known as a Morton's neuroma. Personally, I don't like that term. I feel it's very outdated as it implies a growth or a tumor compressing your nerve. The pathology isn't even remotely related to any sort of growth. With intermetatarsal neuritis, a more modern day term, there is a chronic pinching of a nerve between the long bones and the forefoot. This is a skeleton model, and up between these long bones is where that nerve can get irritated and it can create swelling to that nerve. The most common presentation to the office is that the patient will complain of a feeling that there is a ball of something in the sole of their foot area. It's all wadded up near the toes or a swollen numb area in that region. We have many effective means to treat this annoying issue, and this can range from the simple pad that we train you how to very specifically apply on the bottom of your foot up to injection therapy, MLS laser, and orthotics. I'm really glad to say that it rarely involves any type of surgery for this problem. The other common and more troublesome nerve pathology in the foot and ankle is known as tarsal tunnel syndrome. Of course, most people have heard of carpal tunnel syndrome, which happens in the hand and the wrist. Well, this is basically the same thing in the foot and the ankle. On the inside area of the ankle, there's a very large nerve known as the posterior tibial nerve. This nerve can become pinched or compressed, and subsequently it can lead to problems throughout the entire bottom of the foot up into the toes. This is a much more challenging problem to treat and manage, but again, we have all the means to help patients solve this very annoying problem, ranging from simple things like injection therapy, orthotics, laser therapy, up to surgical intervention if necessary. There are several less common nerve issues that can affect the foot and ankle, ranging from simple cutaneous nerve irritations to actual nerve tumors. And there's a nerve entrapment that happens in the heel area known as a Baxter's neuritis. And probably the worst of all, it's an issue known as complex regional pain syndrome. But don't fret. Dr. Petronella and I are experts at figuring out these issues. Don't let your nerve pain get on your nerves. Yeah, I know, it's a bad pun. But seriously, we have all the means to diagnose your nerve issues, and we can help you solve your nerve-related pain with treatments right here in the office that can be as simple as a temporary pad to the bottom of your foot. If necessary, we'll dive into more involved treatments. And I'm glad to say the vast majority of the time, this stuff does not involve surgery. Dr. Petronella and I are here to keep you moving with happy, pain-free feet. Call us today. Schedule that appointment and let us help you solve your nerve pain issues. Thanks again for watching, and please remember to subscribe below, hit that like button, and leave us a comment. We will gladly answer. We'll look forward to seeing you next time. Have a great day.